My name is Eliana Nahara, and today I'm going to be talking about pneumonia, what it is, what causes it, and how it spreads, and why it matters. I also included a Bible verse at the beginning and end of my slides from Galatians 6:2. Carry each other's burdens, and in this way you will fulfill the law of Christ. I chose this verse because caring for people who are sick is a huge part of healthcare. And learning about diseases like pneumonia helps us understand how we can support and protect others. So, with that said, let's get started. Signs and symptoms. So, first, let's go over what pneumonia actually looks like. These are the symptoms you would typically see with someone who has it. One of the biggest signs is a cough, and in pneumonia, it's usually a productive cough, meaning the person coughs up phlegm or sputum. That's because the lungs are full of fluid and inflammation. Another really common symptom is a fever, usually paired with chills. The body is fighting off infection, so the temperature goes up to try to kill the bacteria. People also experience shortness of breath because the lungs aren't able to take in oxygen as efficiently when the alveoli are filled with fluid. Chest pain is another symptom, especially when someone takes a deep breath or coughs. And overall, there's just a lot of fatigue. Even mild pneumonia can make someone really tired and weak. In more serious cases, especially in older adults, people can be confused, have low blood pressure, or a very fast heart rate. So, pneumonia can show up in different ways depending on the person's age and overall health. Causative agents. Now let's talk about what actually causes pneumonia. This is important because treatment depends on the type of microorganism involved. There are three main categories of germs that can cause pneumonia. There's bacteria, viruses, and fungi. The most common bacterial cause is Streptococcus pneumoniae. This bacteria is a gram-positive encapsulated diplococcus. That basically means it appears as two round cells stuck together, and it has a capsule that helps it avoid the immune system. Another bacterial cause is Mycoplasma pneumoniae, which is unique because it doesn't have a cell wall at all. When we have viral pneumonia, which can be caused by things like influenza or RSV, these are especially common in young kids and during flu season. And finally, there's fungal pneumonia. This isn't super common in healthy people, but it can happen in individuals with a weakened immune system. Examples include Histoplasma capsulatum and pneumoniacitis gyrovecti. Pathogenesis. Let's go over what actually happens inside the body when someone gets pneumonia. It usually starts when germs are breathed in. They make their way down to the alveoli, which are tiny air sacs in the lungs where oxygen exchange happens. Once the germs reach the alveoli, the body's immune system kicks into gear. It sends immune cells to the lungs to try to attack the infection. This immune response causes inflammation, and because of that inflammation, the alveoli start to fill with fluid and pus. What happens? When that happens, oxygen has a harder time moving into the bloodstream. That's why people feel shortness of breath, tired, or even dizzy. The inflammation and fluid buildup also trigger coughing, fever, and chest pain that we talked about earlier. Basically, the body is fighting an infection, and the lungs aren't able to function normally during that fight. This explains why pneumonia symptoms can go from mild to severe depending on how much of the lung is involved. Epidemiology. Now let's talk about who gets pneumonia and how common it is. Pneumonia affects millions of people every year around the world. It's extremely common, and while many people recover easily, it can become serious very quickly in certain groups. People who are at higher risk include babies and young children because they don't have a good immune system yet, adults over 65, smokers, people with asthma or COPD, and anyone with a weakened immune system. Pneumonia is spread mainly through respiratory droplets, which means some can catch it when a sick person coughs, sneezes, or even talks nearby. It can also spread by touching contaminated surfaces and then touching your face, especially your nose or your mouth. It's also more common during the fall and winter months, which makes sense because that when indoor contact is higher and viruses like the flu and RSV are circulating. Pneumonia is actually one of the leading causes of hospital visits for respiratory illness. Treatment and prevention. Now let's talk about how pneumonia is treated and how we can prevent it. Treatment depends on the cause. For bacterial pneumonia, it's treated with antibiotics like penicillin or cephalosporins. Viral pneumonia won't respond to antibiotics, so treatment focuses on rest, fluid, cough medicine, or antiviral drugs in certain cases. Fungal pneumonia requires antifungal medications, which are usually for people with weakened immune systems. Prevention is also a huge part of controlling pneumonia. Some ways to prevent it include getting vaccinated, both the pneumococcal vaccine and the flu shot, washing your hands regularly, covering your mouth and nose when coughing or sneezing, avoiding smoking, since smoking damages the lungs, staying home when you're sick to prevent the spreading of germs. And again, this ties back to the verse from Galatians: caring for one another, protecting vulnerable people, and doing small things like staying home when you're sick are ways that we can serve others and show compassion, just like Jesus would.